Welcome back to Great Day. Dealing with dentures on a daily basis can be a hassle. There's a new option for a perfect smile. You don't have to worry about decay or someone accidentally throwing your dentures away. Dental implants can be a definite option instead. Here with more, please welcome oral implantologist Dr. Farid Noie, along with his patient, Glenda Romano. Hello. All right, Glenda, I'm going to start with you because you are like so many folks who had to wear dentures, and it just, while it could get you through, it just was not a comfortable thing to do.
No, it wasn't.
What was the biggest hassle about those dentures?
You had to take them out, food got underneath them, embarrassment.
And what was the embarrassing part?
Just knowing you had dentures and...
Yeah, and I would imagine oftentimes, too, there's always that fear factor if they come slipping out at just the wrong time.
They do that.
Yeah,
they do that.
You had one of those moments?
Yes, yes.
Oh, all right.
Yes.
Dr. Noie, dentures was a good deal for a while, but we've moved on. Just like technology has advanced and so many other things is advanced here as well.
Yes, and actually that's the breakthrough. We had, you know, the healthcare, we discovered titanium and its unique properties about 60-some years ago, and ever since then the field of orthopedic and dentistry have just changed completely.
Yeah, a lot of us are living longer, so we're outgrowing our teeth.
Absolutely.
And so the option has been to have those bridges, the dentures, all those type of things. But what's amazing about the implants now is that they are stronger and better and more perfect than their original teeth probably ever were.
Absolutely. That's the beauty of the whole thing. You actually have teeth that are stronger than the one that you originally had because they don't decay, they don't need root canals, and they stay there for a very long time, for the rest of your life, and let you enjoy eating your food. Absolutely.
All right, let's take a look at Glenda. We have some x-rays of her mouth, and that she had some issues with the upper teeth, which she had the dentures, and then, of course, on the bottom, she was having trouble with those teeth as well, Doctor?
Yes, and also, if you can see on the right side of the screen, which is her left side, she had lost those teeth a long time ago, and she had no bone left. So, obviously, you cannot place implant where you cannot place a tooth, and she said there is no way she will want to have anything removable in her mouth again. That's what she has on top of us, and then that's what we did with her.
So this is the after x-ray, and what you can see there.
We grow the bone back, we put the teeth, and then at the end she says, I like to have my upper teeth also like my lower teeth, and then we gave her some teeth on top, and now she has a perfect full set of teeth.
For the other half of your life.
Exactly.
Yeah. And look at that smile right there.
That's right.
And when you do them as the actual implants, that means you can actually fit them into the mouth, perfectly into the mouth.
It will be, actually, that's the other thing. I also had to go get a lot of training in cosmetics dentistry because it's not just to do the implant and replace teeth, but you want to do them looking nice.
Yeah.
So not only will you replace them, but also we make them look beautiful.
Right.
So you actually get a smile makeover in the process.
Yeah. So now, when you had it done, what do you think?
I love it. Love it.
Yeah.
I recommend it to anybody.
Not only do they look beautiful, but just that simple thing we talk about, eating. It's so underestimated when you have a full set of teeth, and then when you don't, you're having to deal with the dentures like you said you did before. Now you can eat just like you normally would have.
Mm-hmm. Yes, ma'am.
Now, the other thing, doctor, that makes it kind of problematic for a lot of patients is that if you have to go to one doctor for this and this other doctor to graft the bone, the other doctor for that, it becomes kind of a hassle. I know that there are a lot of patients who just kind of put it off. And you had gone through kind of that in the beginning. And so when you can go to one person, like in your case, and get everything done under one roof.
With the same doctor, that's actually, you're absolutely right. The bottleneck in the whole process, implants are amazing. They can really replace and fix our teeth problem once and for all. But the bottleneck has been in being training, because a lot of most dentists are beautiful. They're artists that can create beautiful smile, but they usually work above the gum line. Implants requires both surgical as well as restorative, expertise, and our field wasn't ready for it. So we don't have enough trained doctors who have done both. So they became a tag team process.
Yeah. Where you would refer patients to somebody, but you got tired of doing that because you saw that it was much more convenient if they could just come to you. So you went to school and you said, okay, I'm going to learn the rest of this.
Exactly, yeah. So I decided this was another 4 or 5 years of surgical training. Let's go, so let's do that. And in the process, now you start the process, you finish it, and everything goes well. If there's ever any concerning issue, you know where the problem is, and you go fix it. There will be no... One of the things with the tag team mentality has been when you do 2, 3 people work on do the same thing. It's like having 2 chefs in the same kitchen.
Yeah.
which is nothing wrong with it.
Well, no, if you have too many cooks in the kitchen, we know that there can be problems.
Exactly.
But the key there is that you know me, I know you. You know exactly what my problem is. I don't have to try to schedule an appointment over here and then try to get in over here.
Exactly.
Okay, so who is a candidate to have these dental implants? And by the way, you can do just one or do a whole set.
Absolutely. You know what? We have now also learned to grow bone, because once the teeth are gone...
Which is the reason why a lot of people do lose their teeth, because bone deteriorates.
Right, you don't stimulate that piece of bone and the bone just goes away. We have learned how to grow bone, tissue, and now we can place teeth. So it turns out to be, we can have actually that's an interesting, here's a patient of mine that he went through some radiation therapy for a sort of cancer that he had, and within a matter of a year and a half, he lost basically most all of his teeth, and they were all goner. And I looked at his mouth, everything looked in trouble, except the one tooth on the upper left-hand side. I decided to replace everything but that one tooth, and now he has a perfect set of teeth again.
Yeah, yeah. There are all kinds of reasons why people can lose their teeth. You talked about that medical treatment. Sometimes it's just genetics. Other times it can be certain drug use that will cause teeth to fall out.
Absolutely, unfortunately.
But the point now is that people don't have to use those temporary things. Instead, they can get those dentures. So when they come in your office, after having you look at the teeth, and you come in early in the morning, you can come in the morning with no teeth and literally be eating dinner with your own teeth.
That night, you can come in the morning with nothing at all, and you go home, and we do the procedure while you're completely asleep. You won't even remember what happened. You go home, and you have a full set of meal at night.
Did it take you a while to know how to smile again?
Yes. Long time.
Yeah.
Yes, it did.
What was the first thing you tore into when you could eat whatever you wanted?
Probably an apple. I don't know.
Probably an apple? We're in Texas. I want you to go for a steak. Go for a well-done steak. All right. Well, for more information on Dr. Noie and dental implants, you can call this number, 281-332-4700. 281-332-4700, or log on to drnoie.com. There you can see how to spell that, drnoie.com. And the great thing about this is that you pay the money, get it done, as opposed to battling for a few years to save bad teeth that aren't going to last you for the rest of your life.
Exactly. You replace something that is just as good or even better.
Yeah, because this will probably last you the rest of your life, right?
Absolutely.
All right.
Absolutely.
There you go. Thank you very much.
Thank you.
It's a Texas